Good morning. Thank you so much for joining us this morning. I am with Oasis Church International and Oasis Community Development Center. Lisa Nicholson. I am the mental health coordinator, and we are here to discuss mental health challenges with accessing mental health services. So I have with me Ms. Katherine Murphy, who is the CEO of NAMI, Palm Beach County, Judge Bradley Harper, who is with the 15th Judicial Circuit of Palm Beach County. If I said it correctly, he will further introduce himself. I have Dr. Monique Brown Faust here. I have Claudia Higgins here, who is a mental health counselor, as well as Dr. Debbie Manigat, who is a mental health therapist. And I'd like to welcome our Zoom participants and just say to you, feel free to participate. If we have any you participants out there, please take yourself off mute, ask questions. You will receive 8 hours of community service for being here. I'd like to thank my pastor, Cassandra V. Fullwood, our senior pastor of Oasis Church International and Oasis Community Development Center, for allowing us to have this panel on this morning. This is a very needed topic because I know, and I'm sure you all know, that there has been such a crisis with accessing mental health services, and we're going to delve into that by having our professionals to talk to us this morning and answer any questions. I am going to start out by asking Ms. Katherine Murphy to come off mute and introduce herself.
Good morning, everybody. Thank you, Lisa, and thank you to Oasis for having me here today. I'm really excited to be joined by all these wonderful panelists. Katherine Murphy, I'm the CEO of NAMI Palm Beach County. We're the National Alliance on Mental Illness. Just a brief note on NAMI, there's over affiliates throughout the country, but we represent Palm Beach County, and we provide free advocacy, education, and support for people who are impacted by mental illness.
Awesome. Yes, and I am affiliated with NAMI Palm Beach County as well by serving on the board of directors as vice president. So NAMI, I like to say, is one of my heartbeats because they have helped me a lot throughout my journey. And I didn't know where else to turn but to NAMI, and they definitely were it was like a lifeline. So we'll find out more information. Let's go on to Monique Brown Faust. If you would introduce yourself.
Good morning. I am Dr. Monique Brown Faust. I am the Chief Executive Officer from Integrated Healthcare Systems. We're a community behavioral health facility that provide mental health and substance use disorder therapeutic services for the community.
Thank you. Now we will have Dr. Debbie Manigat.
Good morning, everyone. I'm glad to be here with you. I'm sorry for the feedback. Are you all hearing an echo as well?
Yes.
Okay. I'm not sure where that's coming from, but I will be brief then. I'm a licensed marriage and family therapist and development officer at a local taxing district. I'm also the founder of Protective Factors Group. We are a nonprofit focused on reducing the disparities in mental health. And my clinical background and training is in infant mental health and birth equity. As we continue, we'll try to fix the audio concerns. So I'll let the next presenter introduce themselves.
Okay, sounds good. So maybe Dr. Debbie, you may want to go out and come back in. That may fix it. Just before we have Judge the Honorable Bradley Harper introduce himself, I just wanted to let everyone know that we are on all of our social media platforms. We are on Oasis Church International's website live. That's oasischurchintl.org. We are on Oasis Community Development Center live. That is Oasis communitydc.org, if I'm not mistaken. And we are also on Facebook Live for Oasis Church International. And we are also on our YouTube Live. So please share this video, share the information so we can have this out to as many people as we can. We want to make sure that we impact the community on today. So Judge Bradley Harper. We'll just have you introduce yourself.
Everyone, good to see you. Can you hear me?
Yes.
Okay, perfect. Of course, my internet connection is acting up now. I am Bradley Harper. Lisa, just let me know if I cut out. I am a judge in the 15th Judicial Circuit, West Palm Beach, Florida. I'm in the main courthouse. I currently serve in the civil division. Prior to that, I've served in the family division as well as the criminal division. I am also one of the judges who volunteers on the weekends at Riviera Beach Drug Court, serving people who have been referred for substance abuse and mental health issues. And also I serve on the community engagement team for our 15th Judicial Circuit Criminal Justice Commission and a number of other things. Thank you to NAMI, Lisa, and Oasis for putting this event together, and I'm glad to be with you.
All right, so we see he serves on a lot. So get your questions together because it's not often that we have our judge in front of us, but I have to say that he has assisted with presentations on another forum that we have. He was one of our speakers. So let's make sure that we ask him any questions that we may have. We're going to ask Claudia Higgins to introduce herself, and then we'll have Dr. Debbie to come back because I believe you can hear her more clear now. So Claudia.
All right, I am Claudia Higgins. I am, a licensed clinical social worker, qualified supervisor. I am the CEO of Higgins Counseling Services, as well as the clinical director of Higgins Counseling Services. I do offer mental health services to the community. I also take on interns at FAU, which I enjoy so much because it's such a beautiful to see my young people growing in our field of mental health and putting them out there. I work with kids from 13 all the way to adults. And my agency is completely virtual. So I don't have a wall-to-wall anymore. It's completely virtual. So it's accessible throughout the entire state of Florida, which I love that. So thank you, Lisa, Oasis, for having me here. I appreciate you guys taking the time to give this opportunity to the community. And I look forward to answering any questions. Thank you.
Thank you, Claudia, and Dr. Debbie.
All right, testing 1, 2, testing. Oh, good. So I'm glad we worked that out. You know, you try to keep it moving and you hope it would level out, but I'm glad you can hear me loud and clear now. So good morning, everyone. We are so excited that you're here so we can talk about access to mental health and making sure you know those pathways to reach out to all of the panelists here. So I am a licensed marriage and family therapist, but most importantly, as many of the panelists know me, I am a community mental health advocate. So this is my joy to share with those in the community about the importance of mental health so we can stop the stigma. As I shared, I wear many other hats. One similar to Claudia, I'm an adjunct professor at Palm Beach Atlantic University, where I teach on family dynamics, marriage theory, and cultural humility. My clinical practice and training is in infant mental health and birth equity, really helping parents through that journey of prenatal and postnatal care. I'm also trained in solution-focused brief family therapy, narrative therapy, EMDR, and satire family therapy, as well as many others that I get to share today in terms of you asking for as you seek your access and on your pathway and journey to healing. So thank you, Lisa, for the invitation, and thank you, Oasis International, for leading in this way.
Thank you so much. All right, so as you notice, we have a variety of support here this morning, wealth of knowledge, and please ask questions. Even if you're on YouTube, if you're on Facebook, you can type in the chat and ask questions, and we will have those questions answered. So I am going to, now some of the panelists have mentioned some of the demographics that they serve, and if you have any additional that you'd like to add, please, if you will. So I'm just going to ask Dr. Monique Brown Faust. We call her Dr. Mo. So if I call her Dr. Mo, that's Dr. Monique Brown Faust. Dr. Mo, what is the population that you serve?
Well, my background, I didn't fully explain, but my background is in forensic psychology and addiction. So the population that we really gear towards is the severely mentally ill adults. We do service children, but majority of our population is severely mentally ill adults that have been in the system numerous of years and also face chronic homelessness.
Okay, all right. And what about you, Claudia? Your population that you serve?
So I work particularly with anxiety and depression and trauma, particularly childhood trauma, and work our way through. As I said, my age group is 13 and up, very broad. That's kind of hitting it out there. So especially, I guess, just anyone that struggles with any form of emotional struggles. That's kind of what we do. We have a broad team that has different specializations. So yeah, that's why we have such a broad scope. Yeah.
Okay, okay. All right. And this is going to be interesting for Judge Bradley Harper, the population that you typically serve.
So we serve in the court system a broad range of the community. Just about everybody comes through for one reason or another, and of course through our juvenile divisions, our family divisions, probate guardianship, just about every division. Some are more directly correlated to judges having involvement in making referrals or even ordering mental health services, um, and in quite a few instances. But we see everyone. Typically, in many of our divisions, we encounter families that are in crisis. So we have a unified family court so that one judge is involved in all of the different legal matters that arise from that one family, and they're not in front of several different judges. And we've recently started a mental health court. There's always been one in our felony criminal courts, but now we have one in our misdemeanor courts. And what that means is that a wider population are able to receive court order to manage mental health services through the court system as an alternative to penal or punishment for whatever brought them into the court system, so that the judge can have direct communication and direct liaison with members of the mental health community to determine whether this person is going to benefit from mental health services more than they are going to benefit from being incarcerated. Now, the last thing I'll say is that becomes particularly important for us. We need the involvement of your community, because our jail system is, the sheriff will tell you, everybody will tell you, it's full of people that are struggling with mental health issues, and they're not treated in jail. They're simply incarcerated. That's additionally important because we have had a large segment of people that come into the court system with either diagnosed or undiagnosed mental health issues. And sometimes those people could end up being incarcerated while they wait to be evaluated for their mental health issues, and spend more time in jail because they are waiting to be evaluated than they would have if they had simply just come through the system and taken the time served or just addressed that legal issue. So it's really important issues that we're dealing with. A large amount of them are mental health related and or substance abuse / mental health related.
Mm-hmm.
I
You're on mute.
You're mute.
Okay. All right, so yes, it's that's definitely a broad range of diverse people that you actually service, and hopefully we can kind of delve more into that, because I mean, I know personally how difficult it is when you cannot get into therapy, or you're seeking some particular help and you cannot get that particular help when there is some type of mental health crisis episode. And it's so important that we have people like a Dr. Mo and a Claudia and a Dr. Debbie and Judge Harper and Katherine representing NAMI, because we see on TV a lot about mental health illnesses and people who are committing suicide, and we see that suicide is running rampant, and a lot of times is because they don't know where to turn to. And this is even starting out as early as, I mean, children don't know where to turn to, or they don't feel like they can open up to their parents or open up to a teacher. So this is going to be very interesting. I like to ask Dr. Debbie.
Sure. So I am a proud graduate of a historically Black college and university, Howard University. I got to plug HU. And so in thinking about what population I really wanted to focus on, I did some research and I learned that according to the Health and Human Services Office of Minority Health, African Americans are 20% more likely to experience serious mental health problems than the general public. Only 1 in 3 African Americans who need mental health care receives it. Only about 1/4 of African Americans seek mental health care, compared to 40% of whites. And then finally, Black people with mental health conditions, particularly schizophrenia, bipolar disorder, and other psychoses, are more likely to be incarcerated than people of other races. So it is my mission to target our community to make sure those that may be underserved or even marginalized gets the mental health care that they deserve, and understand what is that pathway to access so they can get support on their way to healing.
All right, that is awesome. I like that you kind of honed in on your focus, and being an African American, I can truly understand coming from a church background, and if you've ever participated in any of the mental health forums, whether it was live or in person, you would have heard me say that my passion is to definitely go into the Black community as well as the faith-based community, because I am one that was raised in the church, and it was always taught that you have to have faith, and of course I believe faith comes before everything. You definitely have to have faith, but it also, we were also taught that as long as you have faith, you don't need anything else, that pretty much all of your issues are remedied because you have faith in God, and that's it. So I've also seen and grew up where people wear masks in the Black community and we don't reach out for help. It's a huge stigma in our community. So I like the fact that we are reaching the Black community, and hopefully even like yourself and Katherine in a minute, we'll even talk about how that is changing. And, hopefully we see a change, and I believe we have seen a change. I can talk about it a little bit. I'll let Katherine, because we actually have a young lady who has gone out over the past year or so and has impacted, our Black community. So thank you so much, Dr. Debbie. I do see a question, but before we answer your question, I'm going to ask Katherine if she would just briefly speak about the population that NAMI Palm Beach County serves.
So we serve individuals who are impacted by mental health conditions, like my other panelists. But one thing that we also do is we serve the families of people with conditions. We really try to strengthen the family support and education. So everything that we do is free of cost, very low barrier for people to access, but also really integrating, the parents, the caregivers, the spouses, the adult children of somebody who has a mental health condition. So we are open to all conditions, and our services are all peer-led. So they're led by people who have conditions themselves or their family caregivers. And that really helps to create that sense of camaraderie, really understanding the lived experience. And we're a nice complement to other clinical services that somebody might want to engage with.
That is awesome. So if we can briefly talk about, Katherine, if you can talk about what our diversity and inclusion coordinator did over the past year, that would be great.
And just an aside, when Lisa says our, it's because she serves on our board of directors as our vice president. And Dr. Mo also serves on our board of directors. So it's really so wonderful to have this incredible support from the board. And thank you, Lisa, for including us. A few years ago, we received a grant through the DeLuca Foundation to hire a diversity and inclusion coordinator. And she has been tasked with helping out us to make our efforts more diverse and how we reach people. So we've launched the Sharing Hope program, which is a conversational series, and she goes into churches, school programs, so like student programs, and talks to all sorts of different people about mental health and wellness and how it's impacted their lives in a very free form way. And then we've also launched the Pathways to Hope conference. We're preparing for the 3rd annual Pathways to Hope conference. And with that conference, we aim to address mental health in Black churches and ways that pastors, clergy members can support those that they serve, a place for parishioners to come and to learn about mental health and be able to talk about it. Students have been involved in the past, and it's just been a really great experience for us to be able to bring in really great speakers, hold fantastic breakout sessions. Dr. Debbie was our inaugural keynote speaker. And so she just has really helped us to launch the conference, and we're excited to bring it back again this August.
That is awesome. So if you are out there, definitely stay tuned for our Pathways to Hope conference. So we have a question in the chat. How do you know you are at risk? How do you know that you are at risk? And I'm assuming the question has to do with a mental health condition. So I'm going to kind of ask a follow-up question. Would it be at risk for having an episode? Will it be at risk for suicide? Will it be at risk for maybe having to go into the court system? Because we have a variety of professionals here. So how do you know if you're at risk? Unless someone wants to take that and just talk in general terms.
Well, I'll start. As far as being at risk, one thing about us humanly, we know when we're not feeling well. And oftentimes we internalize a lot of things and we don't want to speak out because we have that stigma of not fitting in. So when you know that you're not feeling yourself at 100%, then you're at risk. And you know certain signs that you just should not ignore. And so anytime you feel convicted to be able to speak out or share how you're feeling, then you're at risk.
That is so good. That is so good. I'm so glad that you answered that in broad terms, because I can speak like for myself. One thing that I have learned, I didn't really introduce myself. In terms of from a mental health standpoint. So I was diagnosed with bipolar disorder back in 2007. So I've lived with this for over 15 years now, almost 20 years, and it has not been an easy road. But what I have done, I've made sure that I stay in tune with myself. There are times where it kind of sneaks up on you, but you can still, you will know when you're not at your 100%. So whether it's these emotions that you cannot control. Now, being on medication, you know, it is supposed to help you control certain emotions, but there are times when medications don't work, and there's trial and error where you have to try different kinds of medications. Whether there's something that may trigger you, you can be feeling fine. And especially if you've experienced past traumas, like I have, childhood traumas, there are certain things that can trigger you. And when you feel those triggers, it may be at a time where no one is around to that you can kind of fall back on and get some support, or, you know, you may feel like no one understands. So when you get to that point, that is the time when you may want to reach out to a medical professional. And we're going to get further in detail about 988, etc. But you know you. And if you feel like, you know, you don't really know yourself, again, let's fall back on these medical professionals. I am not a medical professional. I'm studying to be a Christian counselor, but by lived experience, I can tell you what worked for me. So it says, okay, so before we answer the next questions, and thank you so much for clarifying, it says for certain mental health problems, great. So we have Claudia Higgins that like to answer that question as well.
So thank you for asking that question. So right off the bat, there's a tool that I use, and Dr. Debbie knows about it. It's my Oasis. And it's the adverse childhood experience tool that every single client that comes into my practice, adult client, must complete. And that tool, pretty much, it's the adverse childhood. It looks at as various experiences that you've had that are trauma driven, such as abuse, neglect, if a parent's in prison, if a parent has substance issues. Those kind of set us up based on how we cope, how we relate to others, how we communicate, how we function. And that will kind of give us a broad idea about what type of or reasons behind thank you, Dr. Debbie, why you're having these struggles of mental disorders, whether anxiety, whether bipolar, whether schizophrenic, which could be genetic as well. So there are certain experiences that in your childhood that will kind of lay the foundation for you having some mental disorders in adulthood. And that's I think is, you know, if there's certain amount, 3 or above, I would say, if you've hit 3 or above, then you're at risk of having these disorders.
That's really good. Can you tell us what those 3 are? Can you give us some examples?
Oh, the examples I said, if you've had a history of sexual, physical trauma, neglect, a parent who has been in prison, a parent that has been divorced, a parent that has said mean things, words, trouble with your self-esteem, that kind of thing. So if you've hit those marks, it's 10 questions. And if you get more than 3 in those 10 areas, then you're more likely, not just with a mental disorder, but it also can set you up to understand the physical symptoms as well, such as diabetes, high blood pressure. So it's not just the mental disorder, it's also connected to the psychosomatic issues as well. That will lead you, if you're not coping with stress appropriately, we're more likely to house these things in our bodies that causes us to have an increase in certain physical disorders. So we can follow the trail of breadcrumbs. If we've had, and I had one client for the first time that had 10. I was like, whew. And when I look at all the symptoms that they're currently experiencing, like all of it, directly linked to their childhood experiences, directly. So it gives us a very interesting preview that can give us a current status as to, a link between how you're functioning and what it looks like for you in childhood.
Wow.
If that's any.
Oh, yes, that is really good. And I like how you brought out the point that it affects your physical health. I mean, just the fact that you've dealt with all of this trauma as a child, and then you become an adult and you have diabetes too, and you have hypertension. And I'm like talking to the choir right now, so yeah, that's really, really good. Dr. Debbie has her hand raised.
Thank you, Lisa. And Claudia, I love it. I was going to share that tool as well. And so I'll just add on, in terms of ACEs, we want you to know that they are not destiny. So it gives you this picture of your life. And what Dr. Roger Anda says, what is predictable is preventable. So these different experiences can also be changed. And this is why I teach about taking that ownership of your life, finding your agency, because when we can understand through a trauma-informed approach what has happened to us, then we can determine how do we respond to it. And so when the question was put in the chat of what are some of the risks, I really thought it's important then for you to know the signs and symptoms. That way you won't get stuck in mental health and you will find your pathway to healing. And so I always talk about this in 3 areas. So looking at your mindset, looking at what's going on physically in your body, and then emotionally, the social emotional side of yourself. So when you think of mindset, you're going to check, do I feel irritable, anxious? Is there something I feel guilty about that needs to be resolved? Do I have feelings of emptiness, of hopelessness, despair? Do you have an inability to concentrate? And so this doesn't mean that, oh, I couldn't concentrate in class. This means a constant not able to function. Are you having suicidal thoughts, or have you actually attempted suicide? These are the signs and symptoms when you think about your mindset. Now, physically, you're going to check in with, are you having any extreme headaches? Have you noticed any bloating, a lack of energy? You don't want to get out of bed. You feel overly sleepy, or even you don't want to sleep. Have there been changes in your appetite where you're eating too much or you're not eating enough? These are the signs for you to check in with yourself, check in with your mental health professional, as well as your primary care. And for parents, checking in with the pediatrician. Now, lastly, I'll finish up with emotional, some of the signs and symptoms that you should know. If you are feeling out of control, not your normal self, having mood swings, constantly crying out of nowhere, and you're wondering, like, why am I crying right now? Experiencing panic attacks, being disinterested in daily activities, whether it is work if you're an adult, or school if you are a student, and recognizing that this is not a normal state of being for yourself, and that you should reach out to someone to help you understand what is going on in your mind, in your body, and with your emotions. So I hope that was helpful.
Yes, all of this has been great. And I just want to point out that Dr. Debbie has put in the chat, take the ACE quiz. So it is there for you. And this is by Harvard University. So please take this ACE quiz. I just wanted to say, just to piggyback on what our team of professionals just stated, for me, I have made it a conscious decision to be selfish about caring for myself. And everyone may not appreciate that. You may offend some people, but it is important that you be selfish about, meaning self-care. Practice self-care. It is about you. It is about your mental health. If it takes you pulling away, if it takes you, kind of shutting everybody out for a minute so you can regroup, reset, then that's very important. I know I have to do it sometimes. Like I know when I'm very fragile, and if I'm fragile and someone kind of steps on, that fragility, then I may break apart. So I need to kind of pull back a little bit. Like, I represent, Jesus Christ, and I'm not ashamed to say it. And I have to say that I think about David a lot, where David had to encourage himself in the Lord. Like sometimes you may not, finding encouragement somewhere else. Sometimes you have to encourage yourself. And that may mean praying, that may mean reading your Bible, that may mean journaling, whatever it is, and encourage yourself. Affirmations, because you have or your family member may have a mental health condition, that does not mean that it's all over. I like what Dr. Debbie said about what is predictable is preventable. I like that. And I like to add, just because it is predictable, it does not mean it is your end for all, because there is a destiny for you. And I have to say that living with a mental health condition, I'm very successful. Now, yes, I have my moments, but I'm very, very successful at the same time. So that's important. So we're going to move on. We have another question. How do you define an anxiety or depression episode against just feeling down or being stressed? That's really good. Who would like to take that one? So the question again is, how do you define an anxiety or depression episode against just feeling down or being stressed? So I'm going to ask Dr. Mo, you want to take that, or Dr.
Yes.
Claudia? Okay.
It's pretty much actually Dr. Debbie touched on it. It's having certain symptoms of, not wanting, not being able to sleep well, sleeping too much, having, health issues such as severe headaches, overly stressed, having periods of anger episodes, withdrawing from your friends and your family. You could be, when it comes to anxiety, you can have episodes where you're always extremely anxious. And it's it's a difference between just having anxiety or just having like panic attacks. So people need to understand the difference between that, because also having panic attacks, you're not comfortable in certain crowds, you're not, socially engaged with crowds or being in certain arenas. And so there's a lot of different episodes, but as clinicians, we use different tools to be able to identify if you're really, just going through life stressors or actually diagnosed with depression or anxiety.
I also like to piggyback on what Dr. Mo said. I primarily work with, well, not primarily, but yeah, of my patients are depressed or have issues with anxiety. And a lot of that has to do with the mind, how frequently we focus on our negative thoughts, those intrusive thoughts, and how we can break away from them. And learning how to shift our mind is something that a lot of my clients don't think they have the ability to do. I hear the word, I can't, it's hard. And one of the things I've been introducing to a lot of my clients is the verbiage of neuroplasticity, is understanding that the brain has the ability to shift and always can, as long as you're wanting to. So it's when we are in that mindset, we tend to lock in and we get spiraled and stuck in this cycle, whether a cycle of high with anxiety where we're constantly ruminating, or a cycle of low where we're constantly sitting in a very negative headspace. So it's learning how to capture those distortions, learning how to change the mindset, and learning how to reframe and reprocess in a healthier way. And I think Dr. Debbie's gonna come right after me and say, yes, keep going.
Yes. I love this. We're like tag team, next. Make sure that our audience gets all of the information so they can feel empowered. For me, anxiety is a mental and physical reaction to perceived threats. So in small doses, anxiety is also helpful because it lets you know, okay, there's danger here. Be careful, don't cross the street. Or seems like there's danger in school. As we know, unfortunately, there have been many mass shootings at school. So that causes anxiety. There's anxiety here. We got to go for safety. So it protects us from danger and it focuses our attention on problems. But when anxiety is too severe or occurs too frequently, it can become debilitating. So that would be the difference. And some examples of this would be what we've all gone through, the viral pandemic of COVID-19. That was something that literally stopped the world in its tracks. And many people were left in uncertainty. Will we be able to go back outside? Is it okay to breathe the air? What will happen to my teachers? When will we go back to school? Some were saying, okay, I'm fine with being at home. But just recognizing that we live in Florida and we deal with natural disasters like hurricanes that can cause anxiety if you wake up and your home is demolished. And so when you think about the high danger, trauma induced experiences like sexual abuse or physical abuse, domestic violence, these are the things that contribute to anxiety. When you look at a more communal lens, that may be community violence, gun violence, being a victim of a crime. For our students, social media, being addicted to video games, these are things that cause anxiety. So I hope that gives you a good idea of what to be aware of and to check in with yourself. And then feel empowered to talk to someone. Every school in Palm Beach County has a counselor. You can check in with that person confidentially. You can reach out to the church community, and then you have all of these community representatives here on the panel that you can also reach out to.
Awesome. That was such a good question because like you all stated that, it's normal, to even have anxiety about things, but when it becomes an issue and ongoing, then we do need to get help. And it all goes back to knowing yourself and being in tune with yourself. So again, it's so important to get to know yourself. And sometimes, like me, I'm a type of person that I'm helping everyone else. And I've always been that type of person where, I'm so busy helping everybody else and kind of forget about myself. But when this happened to me, I was like forced to look at Lisa. And I'm not saying that it's always easy to do, but you have to do it if you want to maintain a healthy mental health, because there was a time where it wasn't healthy for me and I had to get, serious help. So I so appreciate this. Let's go to the next question. There is a series of questions that we do have. Okay, so what challenges have you seen individuals face with mental health services? What challenges have you seen individuals face with mental health services? So who would like to take that? Katherine.
Start. So we do love our virtual options, and that helps so many people to connect to services. What has also happened is that many people who want in-person services are having difficulty finding those. So we want to have access on both ends. Different people, they feel comfortable with different things. To see a provider, sometimes there are long waits. So you might have a crisis today and not be able to get in to see a doctor for 3 months. And that can be a real problem. And then people might not be willing or able to then go see a provider when they finally can. We've heard of some people who it just gets rescheduled for months and months away. And so then they have an extended period of not getting any help. And then, of course, cost is an issue. Many providers don't accept insurance, or if they do, there can often be very high copays, high deductibles, which just makes it very difficult for people to be able to access care.
That is it. I mean, that's hitting the nail on the head right there. Long waits. You know, I've even looked into trying to assist other people, you know, that whose children was facing mental health excuse me, crises. And you know, just the long waits. And I'm talking about even from a pediatric standpoint, little children cannot even get in to get therapy, cannot get in to see a doctor because of the need being so high. And I was actually reading last night from NAMI national some legislations that we're, you know, trying to get passed. And it was talking about the crises that we're even going to face in the future. Like they're predicting that the shortage of mental health professionals is going to be like 250,000. And that is a lot, you know, so it's a whole encouraging people to go to school, encouraging students to go into the mental health field. So any of our professionals, Judge Bradley, because I know you come from, you know, the court division, you know, I know you mentioned civil court, but many other different aspects as well. How have you seen this impact our community?
So a couple of things. I want to acknowledge the scouts from Troop 116 who are present, and I am the past scoutmaster, and so thankful for their involvement. I also want to acknowledge our courtroom employees and workers who, as we serve the community that are dealing with various crises, the court employees are affected in great ways, and I think in many ways that aren't discussed. That includes our judges, our clerks, and all of the people that have contact with the cases that we deal with. In our court system, we've started to emphasize mental health, and we have seen a great need. We've had some significant incidents involving court employees and mental health situations at the courthouse within the past 2 months. And the only reason I'm not giving more detail is out of respect for the family, but one did involve a death. And this is at the premises. And we also have had people that are not in court employees that have gone and committed significant acts, harm to themselves and around the court premises. So we do see it and we are affected by it. From a broad range in the public sector, the closing of Jerome Golden Center has had a significant impact upon the court system, as we made a lot of referrals to Jerome Golden, and it leaves us with very few options to get people who are in mental health crisis immediate care when they don't have access to private care. I think anecdotally, and you know, I don't know that whether the health providers the clinicians have a perspective on this, but due to the lack of providers that offer in-person services and the long waits, particularly in the African American community, there seems to be a segment of the community that is willing to go private pay in order to access the services that they need. Although I don't know that there are providers out there that offer private pay due to the regulation, the requirements of insurance providers when you accept insurance. So those are some of the challenges we're dealing with in the court system. And I think the last one, particularly for our juveniles and in the criminal justice system, is that oftentimes parents who are dealing with an acute crisis that may be mental health related, maybe not necessarily triggered by a diagnosed mental health condition, they don't know where to call. And so they call the police. And my experience is that the police departments are not equipped to deal, at least to the best of my knowledge, deal with mental health crises, particularly in domestic situations. They come in, and the last time I checked the sheriff's policy, their policy was that when they come to these domestic situations, someone has to be removed from the home, essentially making arrests. And that's a policy that I believe is primarily driven from a liability protection standpoint, where they don't want to go into a domestic situation and then leave, and then it escalates to the point that someone loses their life. But what that does in the cases of family, and particularly juveniles, is where you can see it a lot, is that kids get arrested and they are placed in the juvenile system. And so through our mental health courts, which are just in the misdemeanor section, which are just beginning, we'd like to see a strengthening of the relationship between the mental health community and the court system to, hopefully prevent some of these people from being involved in the criminal justice system in the first place. And to the extent that they are involved, that we can get them the help that they need, as opposed to creating a criminal history that would not be helpful to them. So sorry if that was a long-winded answer. Unmute yourself,
Lisa, you're muted.
No, thank you. No, that was really good. And thank you for that, Judge Harper. And it's so true. We're so quick to pretty much just throw people in jail or throw them in the judicial system. Now, if they committed a crime, absolutely, but let's find out, what is the background of this person? Let's try to help them. Let's try to help them not be reoffenders. And if we can help them to even prevent, let's get in the front of all of this, where we can help our youth, we can help people understand, bring awareness, because there's a lot of people out there that really do not even realize they have a mental health condition. Some people feel like it's the norm. This is me. My mom was like this. My dad was like this. When I look at my siblings, they're all like this. This is just a family thing, but they don't realize that it's abnormal. So that is really good. And hopefully, we will get to that point. And that's something that I think that we would try to press upon. I know Katherine, the CEO of NAMI, Palm Beach County, we've been working hard. I mean, it was, definitely one of our huge efforts to partner with the criminal division and try to come up with some type of partnership when it came down to mental health in the court system. And we're not giving up on it. I'm not sure if Katherine wants to say anything about it or not, but we're not going to give up on that. Go ahead, Katherine.
Sure. So one of NAMI's top priorities is people get diverted from the criminal justice system. And as many people know, we've had the competency mental health court for a long time, but haven't really had, a diversion court or, as Judge Harper was speaking about the new effort with the misdemeanor court. And a lot of entities have come together. We had several meetings with the county and with the DCF and other parties who came together to try to figure out how can we link people to care, because if you want to divert to something, you need a place to divert to. So if there's not a system that can be responsive in a quick and effective way, somebody who's charged with a misdemeanor, it's very hard to compel them to do something to participate in mental health treatment. And so I think that just really building a structure around having adequate and quick resources for people who are ready to receive them is going to be vital to the effort.
And the conversation is important, and these conversations are important so that the right people in the right places can make it happen. I sometimes get frustrated with in the government, the time it takes to make things happen. So I try to encourage myself, and I want to encourage you all, if that's something that anyone is interested in, please let's keep working on it. I think when it does happen, it happens quickly, but sometimes it takes the chorus to begin to move that ball.
Thank you for that. Thank you, Katherine, and thank you, Judge Harper, for that. I believe I saw Dr. Debbie's hand raised.
Yes, thank you, Lisa, and thank you, Judge Harper and Katherine. I think you shine some light on an area in terms of looking at the system that needs to change. And speaking from two lenses for myself in terms of being a therapist and serving the community. As a therapist, I want you to know there are many mental health clinicians of all backgrounds, whether they're our fellow psychologists here, mental health, substance abuse, psychiatry, social work. We are all trying to get the system to change so you can have more access. There are even barriers for us. We want to serve and help as many people as possible, but there are certain criteria that we have to meet. And sometimes, as Judge Harper says, it can take years for us to get there in order for us just to serve. And so know that we also are in the fight for you to be able to serve families. Additionally, I'm thinking about for African Americans in terms of the challenges that I've seen individuals face with mental health services. When you think about the stress of racism or socioeconomic disparities, I love to bring up the research because we are at 20% greater risk of developing a mental health concern, yet the mental health services that we try to seek sometimes are not readily available. As you heard Judge Harper share, Jerome Golden was closed, and that was one of the main hubs. So now we try to divert to other nonprofits who also have waiting lists, and it just builds up. And so despite these efforts to improve mental health services, especially for African Americans and other minority groups, barriers still remain. And that includes the quality of care, the stigma associated with mental illness, sometimes distrust of the healthcare system after you've been treated a certain way. We've already stated the lack of providers. As Lisa was sharing, there is a shortage in the mental health field. So this is actually an opportunity for those of you who are students and discerning what is your call, what is your career going to be. There is lots of opportunity in the family therapy field. And so we need this next generation coming up to join us in this fight and be a part of serving to be that change we hope to see.
You're on mute, Lisa.
On mute.
I think I'm just going to stay off mute. I am just curious if you can share, Dr. Debbie, what are some of the criteria that are challenges? You mentioned certain criteria that you have to have in place in order to serve. So what are some of those?
Sure, for professionals, I think when you look at it from the public standpoint, you're trying to find a therapist, you see someone that you like, and then you reach out to them and they're saying, oh, I'm so sorry, I don't take your insurance.
Yes.
For us as providers, in order to get on insurance panels, you have to be a licensed professional. And so that takes you finishing your master's degree or even going on to get your doctoral degree, and then following the licensure requirements for each mental health provider. So family therapists, social workers, mental health professionals, licensed professional counselors, psychologists, psychiatry, we all have different boards that we have to follow their criteria in order for us to be licensed. And then if you want to open a community mental health center, which is the track that I'm focused on, you have to partner with a medical professional in order to open it. So you may think, okay, hey, I went to school, I got my master's now, I got my doctorate, now I'm gonna open up this community mental health center. And then they stop you and say, oh no, you need this other hoop to go through. And so maybe that is something in terms of the system, Judge Harper and our different representatives like Senator Bobby Powell or Representative Javante Edmonds, they can help us change the way that that is in our law. So family therapists, mental health providers, and social workers can be at the forefront of opening new community health centers so we can get that access directly to the communities that need it most.
That's really good. Dr. Mo, did you have something to add there since you have your practice?
It can be a challenge. It really can be. One of the things I did want to say from earlier is that I believe that there is a shortage of linkage to resources. And a lot of the times, the individuals that we actually get referred to us or individuals that we encounter, it's always a lack of information, right? And so one of the biggest things that even myself and my team, and hopefully, others that I can get to join in, is that we have to find a way how we can get the information to the ones that need it the most. And that's the biggest problem, is a lack of resources or information given to the community. So we do have different providers that's actually within the community. We have amazing providers, like, you have Dr. Debbie, and others that are actually on here, but sadly, the community don't even know half of these providers exist. And so there has to be a way we can get the information into the community so they know. Yes, we have 211, but sometimes that does not always work, for our community, because they don't even have all of the providers that are readily available. Lack of resources, lack of funding. You're right, Dr. Debbie. If either the individual, a certain provider, don't take their insurance. Like, we have a certain amount of insurances that we do accept, and then someone might call and say, no, we don't have it. Yes, the marketplace opened up for the community. But the way that actually works, you can actually be on the panel of like Blue Cross and Blue Shield or Cigna. But if it's from the marketplace aspect, the provider usually has to be selected from the insurance panels to be on there. And so that's a big issue. So individuals can be can be linked to different insurances. But if the providers don't accept it or they're not selected to be on there, then they run back into a brick wall.
That's really good. Yep, that is so true. I've been there. And one thing I will say that I know my provider who was taking my insurance just stopped taking insurance. And I think he was, I think what I heard was that they were frustrated because of, I guess, all the criterias and also getting paid, by certain insurance companies. So my price went from a mere co-payment of like maybe $40 to $180, so, and that's pretty steep. And, I went to refer someone else and did not realize that, well, the first session, which is like your consultation, is $325. So for a single parent that, only has one income coming in, they can't pay $300 and some to just go and get a consult and then, follow up at $180 some. So it is definitely a challenge out there. So we're looking for breakthroughs. Whether we have to go to our legislators, like what I was telling you about. I took screenshots. It was urged Congress to help grow the mental health workforce is what's on the NAMI national page. And it talks about over 160 million Americans, nearly half of the country, live somewhere with a shortage of mental health professionals, and experts estimate that by 2025, next year, there will be a shortage of over 250,000 mental health professionals, including psychiatrists, mental health and social workers, clinical and social psychologists, and school counselors. Like this is like a pandemic in itself, because if we don't have mental health professionals that you can go to, I mean, it's just going to end in some type of demise. But also, I like to mention that I believe that their churches, also the faith-based community, it is so important that we get our faith-based community involved, where people can feel free to go to a counselor, because although they may not be a licensed mental health professional, and help me out, mental health professionals, although they may not be a licensed mental health professional, there is something about going to your faith leader that gives you, and I'm just going to speak for me, that gives you that consolation, that gives you that motivation that you can do it, that you can make it, because you always end up falling back on your faith. And now looking even nationwide, it is definitely a huge discussion about the faith-based community, and I believe it's because, our legislators, our leaders, in communities and in different offices realize that the faith-based community is important. I believe, like when I was diagnosed with bipolar disorder, I personally wanted my pastor. I needed my counselor or therapist. I needed my regular primary care physician, and I needed my psychiatrist to all be in sync. It's almost like an interdisciplinary team. It's like that from a clinician standpoint, because they all work together, where my psychiatrist, therapist, also interact with each other. And I had it where they were sending blood tests, results to each other, and keeping my primary care physician involved in it as well, and in communication of what was going on with me. We need that. We just cannot make it without that. Whatever your faith is, we cannot make it without that. Claudia, I'm not going to keep going on and on.
Lisa, your case is very rare. And I say very rare when it comes to all the parties involved interacting, especially on a private level. I'm in a private level, so it's definitely difficult at times when I'm trying to contact a psychiatrist, and the wait list, and I'll call days, and I'm just like, oh, give me something, like give me anything. I need to know like what's going on with the meds, but any which way. So, but your case is rare. I want to just put that out there, but I want more of that. And that's one of my things, that I want to interact with the different parties involved with my client, whether it's school, whether it's the psychiatrist, whether it's the ANRP, whoever it is. I just feel we need to be on one track. But in terms of getting services to the community and having it accessible, and I know this for myself, like I worked in community mental health alongside while I was doing my mental health practice. So I know what the resources are. And as a social worker, that's my background. My background is social work. My practice is faith-based. So I do a little bit of both. Like I make sure someone might call and say, hey, I don't know, here you go. Like I'm always trying to refer out, because that's going to be how we can support each other. I refer to 211. In terms of people calling and I don't take their insurance, perfect. Do you work? Yes. Does your job offer you EAP services? Yes. Send them over to me. Like it's important to meet the client where they're at, pretty much. Wherever that services is, if I can't provide it, and I know everyone is in that boat, if I can't provide it, I will refer them out to somebody who can. And I believe that's an ethical an ethical stance that all of us must take. And I think everybody on this panel does. If we can't get it to work, provide it, we have to refer it out. So there are different ways that I definitely put things out. Yes, the community, youth and family counseling in Palm Beach offer free services for kids and adults up to, what is it, Dr. Debbie, 24, 22, somewhere like that offer free therapy. Like, yes, go give it out. Like, it's out there. We just have to know how to plug it in. And if we don't know, we refer them to 211.
Awesome, awesome. And I'm loving that you all are putting your information in the comments. Before we take Dr. Mo, I'd just like to also just give a kudos to the troop that is on this Zoom. Thanks for taking the time. And there are some more questions there, and we're definitely going to get to those questions. So thank you so much for being here. Dr. Mo?
I just wanted to say, I wanted to piggyback off of what you were saying about the faith-based. So our church, Friendship Missionary Baptist Church, we're doing a pilot where we actually just did a ribbon cutting for our clinic inside of the church, because the pastor found that the mental health was so rampant and needed. And so 2 days a week, we're actually at the church and we're providing primary health and behavioral health. But you're right, more churches need to get involved and try that, because your congregation is going to trust the pastor more than anything. And a lot of times, yes, it's going to be said, okay, you got to pray. Okay, you got to fast. You got to read your word. But sometimes when individuals are in a crisis, they just can't see that at that time because they're blinded. And that's where professionals come in at. That's what God made us, professionals like surgeons and neurosurgeons in the work. And so sometimes you have to let the professionals handle their professionalism, and you let the journalists like the pastor handle the preaching and so forth. So I believe it, more churches actually need to do it.
That is so awesome. So you're open 2 days a week, and what are the hours?
It's 9 to 3 Wednesdays and Fridays. And so we provide the behavioral health, the mental health counseling, and we also provide primary health. So you have the psych NP that's there, which also provides medical, and you have a therapist and a case manager.
That is so awesome. And is this free?
Yes. Yes.
That is so good to know. Can you put the information in the chat?
Absolutely. I will.
Awesome, awesome. All right. So I know that we have someone from our national, she was in the waiting room. Our National Board of Directors, Dr. Lakeisha. Okay, so what we're gonna do, I'm not sure if if she jumped out or not. I am going to go back to some of our.
I'll just quickly comment. There was a comment made earlier about free resources in the community, and the Palm Beach County Youth Services Department offers free counseling for our youth, and I put that link in the chat.
Yes, thank you. I saw that. I've been clicking on all of them, so I can go back, and then I'll summarize those that I'm able to click on and send them out via email. Okay.
Here, Lisa, as you continue to look through the chat and find more questions, I really appreciate all the feedback around faith-based connections, collaborations, and partnerships. And I wanted to share some of the work that I lead, but also that many of our community leaders are taking part in supporting. And so in my background, I shared my clinical practice, but I just wanted to highlight some of the community advocacy that even you and I, Lisa, have done together. At many churches. My focus is also on serving faith-based communities to stop that stigma of mental health. And so I help churches start mental health ministries. I'm so excited, Dr. Mo, to hear what your church is doing. That is amazing. So proud of you all there. And so I created the I Guide, which actually gives advice from therapists as well as pastors on how to navigate the system to gain that access. What are the signs and symptoms? And then it highlights some local resources. I put a few of those links in the chat. I'll put the link to the iGuide there as well. It is free and open to the public. You can download it and you can share it with your church members. For me, I've recognized that that is the best way that we can make progress is by building partnerships, building that awareness and providing education. When I look at mental health, it is that mental, physical, and spiritual aspect. And we can work together in overcoming these obstacles and challenges. So I hope that those of you who are watching will go to my website. You can download the iGuide and also reach out to me. I have a toolkit that helps churches determine within their own church how they can support their members.
Oh, that is awesome. Awesome, awesome. So it's in the chat now.
I will put that link in right now for you.
Okay, great. All right. So I think we lost Dr. Izzard. I believe she jumped off, but I am going to, if you will please, Pastor, because I had to log back on, I lost the questions. So if maybe those questions can be actually copied and pasted in the chat, or if you would be so kind to ask the questions again. I'm so sorry, but I lost the questions, or if someone else wants to read some of the questions that we have not answered, that's in the chat. And then
I'm just gonna go down. Judah Dukes asks, are there simple ways to deal with mental health at home? Tristan, what inspires you to help with mental health issues? And then Christopher Clark, do you feel discrimination is a symptom of a mental health issue? I'll copy and paste those in the bottom. And then there were a couple more after that.
Okay, yes, that's the one I remember seeing. Who would like to take the discrimination issue? Do you feel that that is a mental health issue? That's a good question.
Well, we know that there can be a 5 to 8 year delay from onset of symptoms until when somebody gets help. And sometimes that can be due to stigma, and stigma can come in a lot of different ways. One way is internally, where you might think, like, I don't want to be identified with a condition, or, I'm not in that group. And people often feel that way because of what is happening in society and the discrimination and stereotypes and lack of access to different things we might need in our jobs and in our lives. And so stigma and discrimination could go hand in hand, and it can really cause people to have escalating symptoms and not getting care in a timely way. We know that getting help early and effectively can help to reduce later negative outcomes. And so if people are afraid about how society is going to discriminate against them, it can really make those problems worse.
Oh, that's good. Anybody else? I didn't know about the 5 to 8 year delay. That's really good to know.
So
And
earlier,
sometimes that happens. Oh, sorry, Dr. Debbie. The families will be concerned about a youth, and they won't want them to have a diagnosis or to have a label attached to them, or to have, to experience that stigma in their lives. And so I think if we can find ways to support our youth and our professionals, everybody, that doesn't lead to discrimination in their lives. I think that's really important, that we can normalize seeking help for our mental health.
It's really good.
And that's when I worked in the school, that was the main concern for most of the parents is, I don't want this on my child's record. Is this going to show up? Is this going to travel with them throughout their entire school life? And fun fact, Palm Beach County won't do that. They won't put any form of diagnosis on a child's file, which is amazing. But they do offer, as Dr. Debbie said, counseling for 12 sessions or more, up to 16 for the child, which is amazing. Discrimination, absolutely. We could see how that can step into a child's just making it difficult, but I can only speak for Palm Beach County. They prefer not to label their children that way, but it is documented that they are getting supported. So.
Okay, so
I'll-
okay, go ahead, Dr. Claudia.
So I just wanted to share, to answer the question about racism. Yes, historic trauma, racial trauma is a mental health concern. And when you think about the new science around adverse childhood experiences or epigenetics, it is shown at your epigenome level how mental health changes the way that we manifest certain behaviors. And so when you think about the history of racism in America and the generations, whether you're looking at your personal ancestors or the ancestors who were actually perpetrating it, there is a mental health aspect for both. And so it is important for us to recognize how that impacts how we treat each other, how we understand each other, and how we move forward to healing. We have not gotten to a place when you look at the civil rights movement where there has been true reconciliation. And so that is an area as mental health professionals that we open this sacred space of healing, of restoration, of recognizing how that intergenerational trauma is passed. And I am speaking from an African-American lens, but I'm thinking also of even present day, people who are fleeing for their lives in Haiti right now, people who are experiencing the war with Israel and Hamas, or thinking about the war in Russia and Ukraine still going on, and how there are immigrants now here, and how they will need help and support for that intergenerational trauma that is passed down.
I'm glad that you went there, Dr. Debbie, because I think that question kind of dealt with just discrimination in general as well. And, you know, when I saw that question, I'm like, that's a really good question, because it kind of stems from probably childhood, what they were taught or what a grandparent went through, you know, and it develops so much anger and, you know, trauma inside, because then you think about also our veterans, you know, and what they've experienced as well, and you know, the mental health conditions that they happen to face because of the things that they've experienced. And yeah, I just think that it's all kind of intertwined as well, because I'll just leave it like that. So it says, and I guess I'm thinking, you know, about the young lady that was killed for driving in the driveway, you know, of someone, and because she was at the wrong house, you know. So, you know, you think about what was in that person's head, what, you know, quickly we say, well, you know, they were wrong, they should be crucified, blah, 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 blah. You know, yes, I think they should, you know, justice should be served. But at the same time, mentally, what causes a person to react that way. I believe it goes beyond, just a person being mean, or I believe it has something to do with the psyche. Dr. Izzard is here. Excuse me, I'm so sorry. Welcome.
Hello, can you all hear me well?
Yes, yes. We are very honored to have you here. This is one of our board members from NAMI National. Hi. So we've had such a long discussion, so we'll just bring you in, okay?
I
And
am so sorry for the technical difficulties. I'm traveling, but I wanted to try to make it on. So yes, go ahead and pick my brain for a little bit.
okay, awesome, awesome. So what we were just talking about was there was a question in the chat, was if people thought that discrimination had to do with the mental illness. And we had Dr. Debbie Manigat to answer that. And there's a question from Judah that states, is there simple ways to deal with mental health at home? Is there simple ways to deal with mental health at home? Did we answer that?
No.
Okay. Simple ways to deal with mental health at home.
Well, hello to all of the beautiful virtual audience, and hello to all of the beautiful panelists that we have on board. But I would say the simple ways to deal with mental health is, of course, to utilize our great NAMI resources. Woo! Please get involved. Get involved with your local NAMI. Volunteer. We're coming up on April, which is Volunteer Month, okay? Volunteer Appreciation Month. But definitely get to know the programming that we have out there. We have family support groups. We have family classes. Get to know what programs are going on within your county so that you can stay involved in learning more about mental health awareness. Something else that NAMI does really, really well is advocacy. If you want to learn how to be a great mental health advocate, please jump on board and get involved with advocacy. We know that now we are currently in a mental health crisis. We're also in a youth mental health crisis. So the more advocacy that we can do to teach our elected officials about mental health is extremely important. That's how you're able to better take care of mental health, not just for yourself and your family, but for all people, because we know that mental health touches every family, which is why I love the NAMI way, because NAMI is for all people, okay? So hopefully that was a help, and of course, learning other coping tools and skills. And you can do that by going to therapy. You can do that by going to support groups, but there are all different types of ways that you can take care of your mental health right at home and within your own community.
That is very good. As I'm not sure if you were on the Zoom before, the young man that asked the question, but that is where I started. When I was diagnosed with bipolar disorder in 2007. I don't know, I always say the year because that year I would never forget, but that's where I started. I started with NAMI. I didn't know what bipolar disorder was. I went online and Googled bipolar disorder from NAMI. And so much information came up, and I went from article to article. And there were times where I actually went into some of the support group meetings. I remember going twice, and I was at such a low in my life, and no one knew I went there when I decided to go. Maybe after the fact, I said something, but I was at a low, and I knew about the support group just by going to NAMI site. And I went in and I was so uplifted. And it definitely, helps in being able to develop that camaraderie with others that feel what you feel. And how they have overcome. And this is why I'm doing what I do, because earlier I mentioned that, you know, I consider myself as a success story, a victor, you know, and not perfect, not, you know, that I don't have my days and moments, because it's still there. I take medication. I have a psychiatrist. I have a therapist, but at the same time, I'm a director of human resources. I sit on the board for NAMI as vice president. I'm an evangelist at my church. So you can, I'm a published author. You can be successful. So you have to choose to take off the mask, though. You have to take that mask off, because stigma is real. If you don't remove the stigma first from within, you know, and the embarrassment and the shame, then you'll find yourself stuck. I just wanted to introduce, not sure if Dr. Izzard knows Katherine Murphy, but our CEO of Palm Beach County, NAMI, is here as well. So I just wanted to introduce you all. I have a hand raised from Judge Bradley Harper.
Well, I didn't want to intervene in the introductions, but I did have a follow-up to the discrimination comment, because it does affect the discussions that we're having in the court system surrounding racial disparity. And what I mean is that one central question that I think as a group we have to answer before we can address the racial disparities that exist in the court system, and particularly the jail. And what I mean by racial disparities is that compared to, for example, the population of Black people in the county, we're overrepresented in the jail by a significant percentage. And then if you add in the Hispanic population, then that number becomes greater. And one of the questions that I think is foundational is whether that overrepresentation is because Black and brown people are committing more crime. Well, period. And that question becomes a loaded question, I think, because a lot of people don't know how to address or to answer that question. But that question has to be answered before we can deal with the disparities, because if you are a stakeholder around the table and you believe that the disparity is as a result that there are more Black people because Black people are committing more crime, that suggests a correlation between race and criminality. And that has to be addressed before we can get to addressing the disparity. And I think from a clinical standpoint, the mental health community comes in line with addressing what those issues that Dr. Debbie and the others were kind of talking about, and how that affects us all personally and professionally.
Mm-hmm. And that has a lot to do with bias too, Judge Harper, and providers taking a closer look at their biases and going through implicit bias training and things of that nature. And for those of you that don't know, I have a background in clinical mental health. So I'm a licensed professional counselor close to 20 years now. And I know I look very young, but I started out even younger. So I like to make sure that you all know that. But NAMI is doing some phenomenal work related to racial trauma. And our focus is JDEI, which is Justice, Diversity, Equity, and Inclusion. And so, and this month is actual what we consider to be the Criminal Justice Month, but we're doing a lot of work around the criminal legal system and mental health and what it looks like. So NAMI's campaign is Overlooked. And so this is for individuals who have been incarcerated that have mental health conditions, and sharing their stories and letting the public and letting people know what that has been like. So we're doing a lot of great work around that, and we call it decriminalizing mental illness. And we do know that there is a disproportionate number of African Americans and people of color that are within the criminal legal system. I do a lot of great work with Black male mental health. And so I know that 40.2% of African American males make up our national prison population. So again, we know that that is an issue, that is a problem. Also, that mental health is the #1 provider in our prison systems, in our jails. So again, we have a lot of work to do. But again, like I said, NAMI is doing some great work in putting focus around that and giving us opportunities and ways to get involved. And like I said, advocacy, advocacy, advocacy. If you're not going to your Board of Commissioners meetings, if you're not going to your city council meetings, please start to make that a priority, because we want our counties to make mental health #1. Here in the state of Georgia, our Association of County Commissioners just made sure to create a mental health resolution so that all county leaders could get on board and sign that resolution. So all 159 counties in the state of Georgia have signed that mental health resolution, saying that they're going to make mental health initiatives first in their county. Now, whether they've started that process and doing it or not is another story, but it is something that we're moving the needle on, if that makes sense.
That is so, so good. And this is why we're having this. It's because we have a heart and a passion for mental health, and we want to evoke change in our community. Judge Harper and I had a conversation, and that was so dear to his heart about the shortage of, mental health professionals and the challenges to just accessing mental health. Before you got on, Dr. Izzard, we talked about, I was on the NAMI national page, and there's an urge, there's a urge Congress to help grow the mental health workforce article that's out there, and actually was challenging people to sign, submit this to our legislators, which I definitely did. And it talked about in the year of 2025, there's going to be over 250,000 mental health professional shortages across the United States. But the part that I did not mention is that we are also, when I say we, NAMI, we are also urging our legislators to adopt this, I believe it's a student loan forgiveness. It's like a repay of up to $250,000 in eligible student loans if you go to school for mental health. So mental health professionals, we're trying to get as many mental health professionals and trying to get Congress to actually adopt that law where they would be repaid up to $250,000. There was also something on there about 988, and I want to kind of get into 988 later, and it was something that I learned. Let's just go ahead and talk about it now. 988 is a line. I'm sure that all of you, the panelists, know about 988, where if someone is experiencing mental health episode crisis, whether it's you or the family member, of a family member, they can dial 988. So what's going on now, which was new to me, is that they are being transferred to a professional, a center, or some type of help based on the area code. So that does not really help individuals. If I'm in a 561 area code and I move to Philadelphia where Claudia is, then that's not going to help me. So they're trying to change that to have it where they can automatically pick up where the person is located and then channel them to the help that they need. Any discussion on that, Dr. Izzard, Katherine, anyone?
So that's one of NAMI's big initiatives is the 988 expansion rollout. It's part of our Reimagine Crisis campaign, which Dr. Izzard can speak to probably more fully. But you need someone to call, someone to respond, and a place to go. So 988, we would hope that it can become part of this larger continuum of support. So someone to call, to have a nationwide number that's very simple for people to know, to remember, to dial. They are working on the geo routing so that it can be, people can respond in your area to the call without people being concerned, like, oh, are they going to know my exact location? But it's more about somebody in your area code can answer that call so that you're getting support and finding out about your local resources. Because if you're connected to our local call center, they're probably going to be pretty familiar with our local resources and be able to support in that way. Someone to respond, our mobile response teams, or potentially trained police officers if needed, and then a place to go. So do we have an adequate place for people to go to get the support that they need? So it's been a big effort. NAMI's been interested in this for a long time, and their grants, they often just come in 1, 2, 3 years at a time. And so we want to make sure that there's continued funding for the long term so that the full system of care can be provided.
Great, Katherine. And they just posted I think it was a press release on the NAMI national page about the current work that they're doing around 988. And absolutely, they're trying to work on getting these individuals routed to somewhere within their local community. Because what happens is when you pick up the phone, you call 988, it's whoever is available, the fastest that is answering the call. And sometimes it's not always within that person's local community or local environment because they may be on another call or something else may be going on. So again, there are some little areas that we still have to tweak, that we have to work on with 988, but NAMI is definitely leading in that and doing the very best that we can to support and ensuring that things are going to get better. If we think about 911, 911 didn't work well. It took several years for 911 to get to where it is now. So now we got to work on 988 because this is our line for individuals who are in a mental health or a substance use crisis. We want them to get the right support. As Katherine was speaking about, we want that mobile assessment team to be able to come to them. We want the co-responder team to be able to respond. That's something that we're starting to in Georgia and in other states, making sure that these counties have teams, which includes a law enforcement officer, it includes a clinician, it includes a peer, a person with lived experience, and possibly includes an EMT. So again, we're working on several different initiatives and efforts to ensure that individuals with mental health conditions and substance use conditions are getting appropriate treatment and getting diverted out of the criminal legal system, if that makes sense.
That's awesome. We have I'm not sure if he's a student, but he says that Delvin says his 988 has been placed on the back of Palm Beach School student IDs. That is wonderful. Can't get no better than that. Is your clinical experience, all right, this is one of our licensed trauma therapists on the line. Is your clinical experience, have you encountered clients, African Americans, who have been misdiagnosed? Could this be a barrier to engaging in mental health services? That's good.
Definitely.
All right.
Katherine actually posted in the chat, and it's true. And within the African American community, more African Americans are diagnosed with schizophrenia or bipolar disorder than a regular mood disorder, of anxiety or depression. Because at the time, especially if they're going to a crisis unit or being placed on a crisis unit at the time, they're being diagnosed based on their crisis at that moment.
Yeah.
And not the whole person. And that can just be one single episode that's happening at that time where they're not able to deal with the stresses or the masses of the stresses that they're going through. And so, yes, I've seen a significant amount of individuals, especially within our community, diagnosed with schizophrenia or bipolar that I just do not agree with.
Wow. So how is that, how do we go by rectifying that?
Well, as for intake within our organization, we always conduct reassessments on everyone. And so the first thing that each individual that is referred, whether outpatient or intensive outpatient, they're reassessed by psych. And so we try to make sure that that diagnosis is correct, because we don't want to be prescribing medications to an individual, because after a significant amount of time, those medications have an impact on individuals significantly. So we always reassess every single person that actually comes into the program just to ensure.
That's awesome. Very good. This is Dr. Mo, and she sits on the board of directors for NAMI Palm Beach County as well. And we have Dr. Debbie. Dr. Debbie is very, very involved with NAMI Palm Beach County, and she's a NAMI member. So Dr. Debbie has her hand raised. Yes.
Sure. Yes, thank you, Lisa. And I'll be brief, Dr. Mo. You got us started in the right direction. And Dr. Izzard, yes, we have so much work to do. I will share from an early intervention perspective. Unfortunately, many of our youth and children, even ages 0 to 5, are misdiagnosed and usually deemed some sort of conduct disorder. Even as early as 4 years old, being suspended from preschool, y'all, preschool, because providers have either bias or are not trained on how to support the children's behavior and recognize the social emotional support that they need. And so this can be done with parents taking agency and asking for ages and stages questionnaire. This can be done also with schools in partnership with parents, finding providers that have training in infant mental health and early childhood social emotional support in order to help those who are the youngest and misdiagnosed with some sort of conduct, instead of recognizing that it could be something from the autism spectrum. And so it's important that we're bringing awareness to this. And so those of you who are listening, you can take this back to your church and to your community to recognize that there are different professional development and training opportunities right here locally with the Children's Services Council of Palm Beach County, where early childhood educators and therapists and social workers can get trained in infant mental health and learn how to help our greatest and little minds.
That's good, Dr. Debbie. And I'm glad that this came up, because I was talking with a mother of a child that is 7 years old who was misdiagnosed by the pediatrician. So here in Palm Beach County, they have to meet with their pediatrician first and be assessed by the pediatrician. And then I guess the parent, the teacher, does an assessment and brings it back. So the pediatrician diagnosed the child with, it wasn't bipolar disorder, ADHD. Diagnosed the child with ADHD. That's the common diagnoses. And so they end up putting the child on medication. The child began to have outbursts of rage where, he attacked his brother, and the parent realized that this is just too much, for my child. And the previous pediatrician that she saw explained the difference between the medication of stimulants versus, a medication that didn't have stimulants, and some children couldn't take stimulants. So she went back to this pediatrician who was the other pediatrician, and she was like, well, no, I think we need to up the dosage and this and that. And she's like, no, I'm not going to up this dosage. And she had to advocate for her child. So that's my purpose of telling this story, is that she had to really advocate and let the pediatrician know, I know my child. So she ended up getting a referral to, I want to say it was Chrysalis. So she ended up getting a referral to Chrysalis and spoke with a psychiatrist there. And it was either psychologist or a clinical psychologist, I believe. And she immediately said, this child has OCD. And it was so true, because we remembered the symptoms of OCD when he was like maybe 1 and 2 years old. And it wasn't ADHD, it was OCD. So there's a totally different way that you will, handle a child with OCD versus ADHD and medication and everything. So it is very, very important that you advocate. Anyone listening out there, advocate for your child, advocate for yourself. Just going back to what I said in the beginning, I believe in, and I know it may be difficult for some of the doctors, some of the therapists and clinicians, but if you be that advocate for yourself, you can do the lead work. You can call your physician and say, I need this faxed over to my therapist. I need this one faxed over, to this doctor. Be your advocate. Be your child's advocate and family member. Okay.
I wanted to also add something. It's important to be an advocate, but what parents also need to know, and not even parents, but everyone that's on here, you could request a pharmacogenetic test done. You can only really get it one time, but you can have a pharmacogenetic test actually conducted, and that actually will tell you which medication will work for you the best. And so that's something we implemented probably like a year ago, because it's really, medicine is trial and error.
Yes.
And just like therapy is trial and error, that's all we do. But for me, it's really making sure that we take care of ourselves and of our family members. So always ask for a pharmacogenetic test.
That is so good. So good. All right, I'm going to try to, it's time to wrap up soon. I wanted to go to one of the questions that I had for the panelists. And we talked about the health insurance, how that presents a mental health challenge. But it had to do with, what do you know about possible legislation presenting a possible solution for the challenges that we are facing?
I've dropped a couple links in the chat, but one thing we're excited about is the Live Healthy Act in Florida, and offering behavioral health teaching schools so that we can help to improve the workforce pipeline, so that more professionals can be trained. So I'll just drop a link about the Live Healthy legislation in the chat.
Awesome. Anyone else?
I'll go next, Ms. Nicholson, because I got to get ready to jump off. This has been so wonderful. And y'all feel free, please reach out to me. Dr. Debbie has my information. Feel free to reach out to me if you all want to partner again. But in our great peach state of Georgia, we made history by passing the largest mental health legislation back in 2022. And that primarily focused on what we call is mental health parity. So that is now our Mental Health Parity Act. And what it focused on was making sure that insurance companies started to look at mental health the same way they do physical health. And of course, ensuring that when it comes to number of sessions, when it comes to co-pays, all of these different things, that is lining up and it's fair, just like physical health. So of course, it's taking baby steps to be making sure it's implemented with all our insurance companies across the state of Georgia. But we know that that is going to really be a big piece. There are other states as well that are looking at different Medicaid options of what to do, Medicaid expansions, all of these different things to ensure, again, that all people, you're going to always hear me say this, all people that are living with mental health related conditions are getting the treatment, are getting the necessary support that they need. And we know that takes insurance. Okay.
That is very good. Thank you so much. So the other two questions is, and Dr. Iser, if you're able to, because I know you're in a vehicle, if you're able to drop your information in the chat, that would be great. If not, then I can pass on the information, as well as I think you said Dr. Debbie has your information. Who do we need more help from, and what do we need more of? That is the question. Who do we need more help from, and what do we need more of? So this panel, this was awesome, but I don't want us to stop here. I don't want us to just have a discussion. There needs to be a solution. Where do we go from here? Panelists.
So Dr. Iser, do you want to close this out before the rest of us speak? Because I know you have to go.
Go.
All right. I was putting my website into the chat, But pretty much the only thing I want to share to take us out and to end us out again is that NAMI is an amazing organization to be a part of, to learn, to grow more about mental health, to learn how to support your loved ones, to learn how to support yourself. Okay. And then also so that you can understand more about your gifts and what you can offer to people with mental health related conditions. That's one of the things that NAMI did for me as well. Yes, I knew that I was a great clinician, great practitioner, but of course we have so many more gifts, okay, than just direct care and counseling. And NAMI allowed me to be my authentic self and being able to share my gifts, so much so that I've grown in NAMI in a very fast pace of time to already now be on the national level as a leader. So again, NAMI is just a great place to grow and to learn in our own voice, peer to peer, ending the silence. I mean, you can name me. Yeah, I'll brag about NAMI all day long. But all of those programs are impactful in some type of way. So jump on the bandwagon, find out what you connect with, get involved, stay involved, be a part of our NAMI walks, that we do every year. Go to our free webinars. There's one coming up on diversity. Go on the NAMI Facebook page, on the NAMI website. We're going to have our own Dan Gillison. We're going to have Dr. Sheldon Jacobs, who also serves on our National Board of Directors on the Executive Committee as our secretary. And they're really going to dive into what diversity in mental health looks like. So again, get involved, learn, and make sure that you're doing everything that you can to be an advocate for mental health.
That's awesome. 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 Thank you. Thank you.
Thank you, Dr. Izzard. So great to see you. And thank you, Lisa, again, for having us. My two final points to wrap up, speaking about what acts do I know of. In 2022, we had the Mental Health Improvement Act, which brought in family therapists and mental health professionals to serve with Medicare. And that's huge because we know our baby boomers will be the largest retiring group. And so we have to be prepared to serve them. I am a Medicare provider now, and I put a link in the chat about scholarships for other students or young professionals or interested professionals who want to go into mental health. Locally, there is a scholarship from the Children's Services Council of Palm Beach County. It's called the Healthy Beginnings Scholarship that will pay for your mental health tuition and school-related expenses. And truly, this is my focus area of advocacy. Mental health awareness in African-American community and churches, because the difference of what we do and don't do, it's lethal. Suicide is the 10th leading cause of death and accounts for the loss of more than 42,000 American lives each year. So we have work to do, and I'm glad to do it in partnership with all of you. So thank you again for having us today, Lisa.
Thank you, Coach Debbie, Dr. Debbie, thank you.
All right, I guess I'll follow Dr. Debbie. Thanks, Dr. Debs. That's a hard one to beat right there. Okay, so regarding the law, so they've been working on the social work compact law for the past, 3 years, where we're trying to interchange social work without borders, states without borders, I should say. So we should be able to serve anyone, anywhere throughout the United States. Right now, we have about 10 states. 17 now. Mm-hmm. See, numbers keep growing. Thank you so much, Dr. Mo. It keeps growing. And Florida just joined on the bandwagon. So I'm super excited. We haven't passed the law yet. So we're hoping that that will come and make it more accessible to anybody, anywhere. My advocacy is always to bring mental health to not just to the church, but to the community, any which way I can. I am going to join with NAMI, Lisa. I've been saying that for years, but now I have a little bit more time to dedicate my time to that just before starting school. So that's where I am. And thank you for hosting me. I appreciate the time, everybody. This was really great. I really enjoyed being on this panel. Lisa, anytime, hit me up.
All right. Thank you. Thank you. That was going to be my next push is if you are not a member of NAMI, please go to NAMIPBC.org and you can become a member of NAMI. We have a lot that you can get involved with. So next, I'm going to be our CEO.
Hello, and I believe the question is, what do we need more of and what can people do? Well, I'd say that we need to be all in.
Yeah.
You know, mental health, we know 1 in 5 people have a mental health condition every year, but you know, mental health affects us all. And if we don't have a condition ourselves, we still have to do our own mental weight maintenance. And so, you know, just continuing to educate yourself on how mental health impacts you, your family, your community, somebody that you might meet. So I'd say that we all just need a little bit more compassion, empathy, understanding, and education. So just that continuous improvement and looking into these topics.
Very good. Yes. Yes. Thank you, Katherine. Dr. Mo.
I will follow behind Katherine and say, yes, education. We need definitely more education, educating our police departments, educating our legislation, educating the community at a whole, and more collaborations. We definitely need more collaborative efforts between agencies. It's a significant amount of different agencies that's out here working. Some are just silos, some is not even known about. But I think pushing more collaborative efforts between different organizations and even single individuals that's out here in the trenches doing the work it may not, quiet the whole entire problem that we're actually having, but it can make a significant impact.
Yes. Awesome. Awesome. Thank you, Dr. Mo. All right, Judge.
Thank you, Lisa, and to all of the panelists and participants. I think we've heard some great opportunities that we have to impact our community in a positive way. And so I hope that everyone got some takeaways. My last message would be that of love and grace, operating from a foundation of love and grace. As someone who needs a lot of grace, I think it's important that we dispense it as great as we need it. And I always find, at least in my personal life, when I operate from a center of love and a center of grace, that the outcomes are always the right one. And when I operate from a center of anything else, I'm having trouble accomplishing anything that is good. And so I want to say that to everybody who is working in their different spheres on the different things that they're trying to achieve and the challenges that they're trying to overcome.
That is awesome. I would love to be able to add you as an honorary member of NAMI, Judge Harper, but because that is not what we do, you need to become a member of NAMI.
All right, I got it.
I would like to say thank you to our panelists. You all were awesome. And we will make sure that this is broadcasted. Even if we have to do it over and over again, I'm going to definitely do it on my page, share it on your page, so this can get out to the community. I know it was live several places. To our participants that are on the Zoom, thank you. Thank you so much for being here. I know you gained a lot of information. If we can just leave up the chat just for a minute for anyone that wants to copy the information that's on here, that would be great. Thank you to the troops. Oh my goodness, you all amazing. Amazing young men. Judge Harper is a scout leader. We have Dr. Debbie and her young men here. Oh, that's awesome. Thank you all so much for being here. And if you are a high school student and you have been on this chat and have participated participated, have gained something from it. I know our panelists, we were talking more than anything, but if you need community service hours, please make sure that we have your information and I will send out the certificates. Thank you, Pastor Cassandra Fullwood. Thank you so much for allowing us to have this panel over and over again. We've been doing this since 2019. We've been doing it in person. We've been doing forums online, and I cannot say how much I appreciate you having a heart for mental health. We will have more coming up. In the next couple months, we're going to have another mental health event. So please stay tuned. And she was also our tech team, one-person tech team. So thank you very much. And everyone have a blessed day. If we could just keep it up just for a minute, Pastor Sin, so we can just make sure we get all of the links that's here.
Everyone have an amazing and awesome rest of your weekend. And thank you for having me.
Oh, thank you so much.
Thank you for having me. I have got to run. You guys
Thank
have a blessed
you.
one.
You too, my dear.
Bye.
Bye-bye.
Bye-bye.
Bye-bye. Okay. I'm positive have to begin. I got Joyce. No. Scholarships. I need to get the Florida governor. Incentives. Okay. Okay. Thank you.